Well, good afternoon. It's great to be back in College Park. President Pines, thank you for that kind introduction. It's wonderful to be here at our flagship university to announce an exciting initiative in our No Arm Left Behind vaccine campaign. For the past several months, we've deployed a team of more than 11,400 people and stood up over 3,000 points of distribution in a massive all-hands-on-deck effort to make sure that every single Marylander who wants a COVID-19 vaccine can get access to one as quickly as possible. As a result, Maryland is already one of the most vaccinated states in the country. We have vaccinated 92.1% of all Marylanders over the age of 65, and last weekend we surpassed the incredible milestone of having vaccinated 75.2% of all Maryland adults. So these are much better rates than the nation and almost all other states. And as the number of vaccinated Marylanders continues to grow, the number of infections, hospitalizations, and deaths continues to fall. Our 7-day positivity rate is 0.73. One of the lowest in the country. And our case rate per 100,000 is 1.08, also one of the lowest in the nation. Hospitalizations are down from a high of 2,000 to 133 today. And earlier this week, we concluded a very successful $2 million vaccine lottery, which helped increase our vaccination rates and saw 41 winners from all across every region of the state, including a nurse from Frederick, a retiree from Elkton, a construction worker from Annapolis, a high school teacher from Elkridge, a school custodian from Indian Head, grocery store worker from Towson, and a child care worker from Silver Spring. The initiative was such a overwhelming success that we're now turning our efforts toward getting more of our young people vaccinated against COVID-19. And so today, we're here in College Park to announce an exciting partnership between the Maryland Department of Health and the Maryland Department of Higher Education Commission to provide $1 million in college scholarships for Marylanders aged 12 to 17 who get vaccinated. Beginning next Monday, July 12th, utilizing the same random number generator that was used for our successful VaxCash promotion through the Maryland Lottery, the Maryland Department of Health and the Maryland Higher Education Commission will select and award a $50,000 scholarship or the equivalent of full tuition and fees at public in-state institutions of higher learning to anyone between the ages of 12 and 17 who is vaccinated in Maryland. We'll award 2 scholarships every week for 8 weeks through Labor Day, when we will then, on the last day, pick 4 winners. That's 20 drawings, each one with the chance to win $50,000 scholarships for a grand total of $1 million in scholarships. Now, the winners will receive a Maryland 529 prepaid college trust contract, which locks in today's tuition rates for the future, or a Maryland 529 college investment plan. And the winner, if they decide down the line, of course we'd love to have them attend our state universities, but if they decide down the line that they would like to attend a private institution or a school that's outside of the state of Maryland, they can actually transfer the scholarship to the school of their choice. So entry for our $1 million VaxU scholarship, as we're calling it, is very simple. If you're a Marylander between the ages of 12 and 17, all you have to do is get vaccinated for COVID-19 here in the state of Maryland. Those who've already been vaccinated here at any time are also eligible for these scholarships, and you will automatically be entered to win. If you have not yet been vaccinated, the sooner that you do, the more scholarship drawings that you'll be eligible for. The Maryland Department of Health will work with the Maryland Higher Education Commission to notify all the winners. These scholarship funds are being provided through funding from the American Rescue Plan, so federal dollars. And once again, all you have to do is go out and get your shot in order to have a shot at winning a scholarship to the college of your choice. Promotions like this are just one more way that we are reinforcing the importance of getting every single Marylander that we can vaccinated against COVID-19, especially our young people. And it is clearer than ever before that these vaccines are extremely effective, but those who are unvaccinated do remain at risk, especially with the new highly transmissible variants, including the Delta variant, which is currently circulating. According to our state health department, 95% of all new COVID cases reported last month were people who have not been vaccinated. 93% of all new COVID hospitalizations were unvaccinated Marylanders. And 100% of all the COVID deaths in the month of June were Marylanders who were unvaccinated. If you have not gotten your vaccine, the virus and its variants are a dangerous threat to you. Getting vaccinated is the only way to protect yourself and to continue on our recovery. So if any of our 12 to 17-year-olds or their parents needed another good reason, then now they can go out and get vaccinated for a chance to win a $50,000 college scholarship. At this time, I'm going to turn the podium over to the Chancellor of the University System of Maryland, Dr. Jay Perman, to talk a little bit about this opportunity for college-bound Marylanders. Dr. Perman.
Thank you, Governor. I am really so happy to be here today. I hope the scholarships Governor Hogan just announced persuade more young people to get vaccinated against COVID, persuade more parents to take their children in for the shot. I cannot imagine a better incentive than a covered college education. And yeah, I'd be derelict in my duties as chancellor if I didn't say that I hope the scholarships lead more Maryland students to discover one of the university system's 12 institutions, where we have something for every learner. Every student can find a home, a community within our public university system. And I promise you those dollars will go far with us. But I'm not only the chancellor. As some of you know, I'm also a practicing pediatrician. And so I have another reason to applaud the governor's program. As you just heard the governor say, we hit a huge milestone ahead of the July 4th holiday. 3/4 of Maryland adults with at least one dose of a COVID vaccine. That's terrific news. And I'm grateful to be in a state that has made a vaccination a public health priority. But we cannot let up. We know that vaccination is lagging among certain populations, young adults, teenagers. And we also know that young people do get sick with this virus. And as you heard the governor say, we're particularly concerned about the threat of the Delta variant. So, as someone who's cared for children my entire career, I'm fully on board with everything that protects our young people. And if these scholarships get vaccines into the arms of more adolescents, more teenagers, count me in. For me, as a physician and an educator, it couldn't be a better perfect marriage. We're pairing the health of our young people with their chance at no cost or low cost college education. I thank the governor and his cabinet for this generous program.
With that, we'd be happy to take a few questions from our friends in the media. But first of all, I want to thank President Pines and Chancellor Perman and our cabinet secretaries, but we left out the most important person. I'm really proud to be here with Testudo today. Thank you for joining us, Testudo. He's probably going to be the biggest hit, so sorry we left you out. He's a very important member of the team.
Governor, can you tell us what are your thoughts on the hesitancy for young adults to get this vaccine?
We're not having as much hesitancy as we're seeing in most places around the country. We did start later with the 12 to 17-year-olds because they didn't have approval. We're outpacing the rest of the nation on the younger folks as well, and I'm hoping that we'll just have a chance to catch up. But like with every age group, there are certain people who are either just haven't gotten around to it, that they're like, well, I may get it, but I just didn't feel the need. And there are others that are, just opposed to it, and they're hard to convince. But I think there are more of the folks that maybe just need a little extra incentive to go out and do it. And we're hoping that this opportunity at a college scholarship and us getting out talking about the importance of it will help encourage some more young people to do so. Particularly, as I pointed out, nearly all of our deaths and nearly all of our hospitalizations and infections are just simply the people who have not gotten a vaccine.
Governor, quick question, sir. To ensure that parents who live in Maryland for their children will be getting it, how do you ensure that people from across the border in D.C. or Virginia don't take advantage of a program such as this?
Yeah, so there's a system called Immunet where every person that gets a vaccine, it goes into a computerized system that the Department of Health has been working with from the beginning of the pandemic. They're working in conjunction with the Higher Education Commission. So if you're a Marylander who got a vaccine in Maryland, they have that information. If you're from somewhere else, you won't be listed in the Maryland Immunet. And so it'll only go to Marylanders of that age group. They'll be picking the random numbers just like they did in the lottery, but 12 to 17-year-olds can't play the lottery, so it's going to be done through the Higher Education Commission with the Department of Health.
Saying that this is modeled so closely after the vaccine lottery, I was wondering if you could tell me about any evidence that exists that the vaccine lottery did encourage more people to get the vaccine.
Well, the only evidence is that, we really ramped up after we announced that. We were having winners from all across the state every week, and I can tell you anecdotally, people were saying, I'm going to go out and get my chance at winning that lottery. And so we had already been doing really well, but it was getting, harder and harder to get people out, and we saw a bump after announcing that program, more people that just needed that extra push, and which is why we think we'll hopefully have the same success with our younger people. Yeah, maybe Dr. Chan can address that one, but we're concerned that many of the cases are from the Delta variant, which is much more virulent and spreading faster among unvaccinated people.
We have only detected 64 cases of the Delta variant here in Maryland as a whole. Only a handful of them have been hospitalized. Of the individuals who have been hospitalized post-vaccination, they have been primarily the Alpha variant, or what was known previously as the UK variant. We are keeping a very close eye, of course, on this new Delta variant. I think the CDC director just discussed that last week, that nationally it has grown to close to 50% of the sequence cases. We are not at that level here in Maryland. I think most of the cases are being seen out west, where, as has been noted, there is a lower rate of vaccination than here in Maryland. So that's why we continue to emphasize that vaccination is our most important tool to protect people against this variant and others.
Though everything's been down, we've seen the bottom in hospitalizations. It's a small number, so statistically, percentage-wise, it's a large uptick. But the numbers have come up in hospitalizations, positivity in recent days. Is that the Delta? And again, are they all, I assume, still the unvaccinated?
So to reiterate what the governor has said, you know, the majority of the people who are going into the hospitals now that we've seen recently are those who are unvaccinated. You know, I can't comment on the sequences that may be, you know, for hospitalizations that just happened, because it does take still a little bit of time for those sequences to be completed. But we are making every effort and are partnering with Hopkins and the University of Maryland in Baltimore with Dr. Perman's support to sequence every single person who's been hospitalized in those settings.